Breast cancer vlog, day 51. 1 week post-op. Been a challenging week. I haven't experienced this level of pain ever, and it still hurts quite a bit, but I'm vertical, and I want to go over some stuff. So let's start with the really good news. My lymph nodes are clear. The surgical margins were clear. They got it. I did have cancer in my left breast, ductal carcinoma in situ, but it was only in the milk duct. It hadn't gone anywhere else. My right breast was clear. So last night, for the first night in 50 days, I actually could sleep with peace. I think, honestly, I mean, the surgery itself is so traumatic because it changes your physical appearance. But just as traumatic is the wait for pathology and the wait to know what the rest of your life is going to be like. Because when you've been diagnosed with cancer, and if it's active cancer and it's spreading through your lymph nodes, that is a very, very serious, life-changing battle. Chemotherapy is daunting. Radiation is daunting. And I consider myself so incredibly blessed and relieved. I just sobbed. You know, it was crazy because my surgeon's office called at 9 a.m. yesterday morning and they said, she'd like to talk to you. Are you available in 45 minutes? And I'm like going, okay, yeah. And you know, bad news usually travels by phone, although I was expecting a phone call anyway, but her impression was just very, very serious. And so I shook in my boots for about 30 minutes, and then I went and woke up my sister and laid in bed with her while we waited for the phone call, and just crying and scared. But this is the best case scenario, and I'm so thankful. And the surgery was the right thing. Now, for anybody who's squeamish, I want to say thank you for your support, but I'm going to show you stuff now because I think it's important we all understand what surgery like this is like, not only for the patient, but also for the family. And so I'm going to show you stuff now. I think you need to see what breast cancer patients deal with. All right, so let's do it. Okay, so as I shared in my last video, you wear a compression brace. This is so important. If I'm not wearing this brace, there's tightness and pressure in the incision that is really uncomfortable. In fact, I was talking with the surgeon yesterday and I'm saying, what is this? Because it was like, first we had 4 days of really intense surgical pain. Then as the surgical pain calmed down, now it's like the tissues and the nerves are starting to grow back and they're pissed off. And so I went without pain meds for a day. Big mistake, because this is still level 5, 6 pain. Okay, so that's a compression brace. So let's take this off. And I've taken 1/4 of a Norco so far this morning. Okay. You know, and at first that feels good. And then things start to pull. Okay. So this is not porno because there are no boobs there, my friends. So don't report this as porno. This is medical. This is so we all understand it. Okay. So we took the bandages off last night, and now you can see scars. And you can see under this one, there's a lot of bleeding under this side. You can still see the bruising on this side. And then underneath here is the drain. That drain is weeping a little bit. So if we go to this side, there's an example of a drain that's not weeping. The scars are big. They literally go from the middle of my armpit all the way, and you can see that there's this concaveness there. And I'm assuming that if we were to do reconstruction, we would be doing fat in this area to just kind of plump it up. The incisions themselves are, like, this area is completely numb, or numb. But in the same sense, it's just the weirdest feeling. Absolutely the weirdest feeling. Like the other night, my right nipple zinged really hard, and I'm like, I don't have a nipple. What is zinging? And it's the nerves. And then this right here, I think there's still tape there. That's tender. And she took 2 lymph nodes on this side. And yet it's funny that it's the right side. What is that? I can't really see what that is. Is that tape? I don't know what that is. Yeah, there's a little bit of tape. Yeah. Is that tape? Okay, well, anyway. So that's what a mastectomy scar. I didn't expect this whole concave area. Do I regret anything? Of course not. Of course I don't. I think what's funny is if I'm wearing I can't wait to get back and wear a regular tank top. And I'm gonna, the irony is I've been saying all this time that I've been held hostage by sports bras. I'm gonna be held hostage by sports bras for some time to come because I have to have that compression. And I'm hoping that my existing sports bras will do that. All right. Okay. So like right now, it's just, what is it like? It's just prickly. It's annoyed. It's angry. Oh wait, backwards. I was gonna film a video a couple days ago about sex. And the value of, breasts in sex. Because guys like breasts, but, would a guy like me without breasts? Okay. Whew. We did it. Drains are coming out tomorrow, so they'll be gone by tomorrow. But I wanted to show them. I really, really wanted you to see them in place for anybody who's doing it. So, like, what advice would I give to the patient? Number one, for God's sake, get your mammograms. Do it. Because the earlier you catch it, the better the odds. Number two, don't be afraid of surgery, but understand that this is not a little surgery at all. This is a really major surgery, and you're not allowed to go back to work for like 4 to 6 weeks, potentially. I can see the physical recovery, but there's also going to be an emotional recovery. Like right now, I honestly just click no when somebody calls my business. I'm not talking to anybody. Business side. Number one, I'm medicated and I shouldn't be doing that. But number two, you know, I have to respect the fact that I'm not capable right now of doing my patient education one-on-one. I'm just not. Yeah. I'm in. And so emotionally, I need to be sitting out in the sun to just get over the trauma of this. Now, for family members, my sister and my brother-in-law have been with me constantly since the day before surgery. In fact, they're gone now. And I just said, it's okay. They're gone. My brother-in-law has been invaluable because he's literally picked me up when I fainted. And he's such a calm port in the storm. And the first time we looked at the incision and I was very weak, he basically just lifted me up and held me up so that I could look in the mirror. We could all look in the mirror and see what the hell was going on down here. My sister is mother. She's making food. She's giving hugs. We're having good talks about lots of different things. I feel so blessed. I can't imagine doing this alone. And so to family and friends out there, if you have somebody that you care for going through this, be there. And don't believe them when they say they're okay. They're not okay. I'm not okay. I'm better. The trauma is real. The emotional trauma is real. And so I'll do another video about how to prepare for surgery and what I would do differently, and looking at it post-op. But I just kind of wanted to show you where I am today. Alrighty. So I'll see you again soon, I'm sure. I think once the drains are out, things are going to start to feel much, much better. But again, I think the thing that shocks me the most right now is that I just have to stay on a little bit of pain meds. Without it, the pain is still a 5 or a 6. And that's icky. All right, I'll see you on the other side.